You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hey, Dr. Dufour, how are you?
Hey, very good yourself.
I'm great. Thanks for coming over. Tell us a little bit about your beginnings first, so we give listeners a little bit of an overview of how you started in medicine.
Yeah, so I'm born and raised in Montreal, Quebec, Canada. So enjoyed a great education there. Slightly different than in the US, much affordable in a sense, um, and yeah, very proud of the teaching there. I mean, everything that I learned there. I worked also in Quebec for about 10 years before I finally made the move to the US. Yeah.
Nice.
Yeah.
And which specialty did you sign up for
Yeah.
in US then?
Yeah. So I'm family medicine. So that's my training.
Okay.
Yeah, I had a very diverse career. When I started my career, I did a few years of emergency. I did a lot of hospital work. So back in those days, when you were family medicine, you're still allowed to do all those things. So I got very diverse experience in that sense. So both on the inpatient and outpatient sides. Yeah.
Mm-hmm.
And I work in Quebec. I work for 10 years rural, which makes sometimes you have very little access to specialists. So you learn to do a little bit everything by
Yeah.
yourself. Yeah.
How is the experience of doing rural medicine in Canada versus rural medicine in US? How was the what was the thing what was the biggest difference between the two systems?
Yeah, it's very similar. The challenges are the same. There's a lot of things to do with sometimes very little help. Um, yeah, they're both, I mean, they're very similar in that sense. Yeah.
Hmm.
Yeah.
Interesting. Okay, so you came to the US and you said you came to Florida first time.
Yeah. So when I did all my training, I kind of had it always in the back of my mind to come here in the U.S. So I wrote all my boards exam, the U.S. board, and somehow I was just getting ready for it. Uh, at some point, I knew I would make the move. Then I met my wife. We built our family first in Canada, and when we felt the moment was right, then we moved to the U.S. Yeah, I first moved to Florida because I had quite a special market there. So I was still taking care of my country people when many of
Hmm.
them vacation in South Florida. About 300,000 of them every winter they go there, and unfortunately, sometimes they fall sick. So I started there in Florida taking care of those folks, both on the outpatient side and inpatient, and sometime when need be, we would repatriate them in their country, in their original country. So um, I have kind of that niche practice, if you want, because I'm French speaking. So many of those folks sometimes don't have a broad knowledge of English. So um,
Yeah.
and, and that was a great experience. I really enjoyed it. So in the southeast of Florida. So I used to be affiliated with Tree Hospital down there, and back in those days, these were open ICU, so you would follow your patient all the way to the ICU. So great experience, great memory of those times. Yeah.
Yeah, that's great. What made you move out of Florida and now you're in California, right?
Yeah. Well, it was, I mean, for anybody that knows the Florida market, back in those days, it was very competitive. And my work, although very nice was very seasonal. So, you know, basically those folks would come there 6 months a year, and the rest of the time would be quiet. So uh,
Hmm.
I kind of enjoy the country very much. So I figure we would go around and see other things. So I'm very grateful. I mean, I love the U.S. I've been in different places, very all beautiful places. So U.S. was a large playground for me. So um, I got to. I'm lucky. I got to practice in many beautiful states and beautiful places. Mhm.
So, what do you think it's the difference between practicing in all kinds of places in US? Because usually, especially in primary care, I think people kind of settle down in one place, right? And they build a community around them, and they practice in their own office, and they have their, niche and demographic of patients that they're taking care of. But you experience something a little different.
Yeah, yeah. So I think that I've worked in very different environment. You know, I think part of it is me, you know, studying. I went back to school in 2015 and hasn't stopped since then. So I went to learn about healthcare administration and things of that sort. And I kind of wanted to put that to practice in some way, you know. So I'm those all this school has helped me getting nicer and better opportunity, things that would open up, and in that way, I took advantage of this, and
Hmm.
yeah. So I've worked in most setting, you know, for profit, non-for-profit, governmental agency, federally qualified healthcare centers. So it was kind of my path to really understand everything about the U.S. healthcare system, which I'm fascinated with. Um, I did some study in healthcare economics after that, and that's kind of my hobby in a sense. So it was important for me to touch a little bit of everything to understand it fully. Mhm.
Yeah, I'm curious to see what are some of your conclusions regarding the U.S. healthcare system. It's a broad topic, but I think you have a little bit of knowledge practicing in all those settings. What do you
Yeah,
think about it?
yeah. So I think I hold a particularly controversial opinion in the sense that I think that the U.S. healthcare system is the best in the world. I really believe that. I come from Canada. I totally had the chance to come here or not, but I did it with because I wanted to experiment it. And I truly believe that although the system is not perfect and can be fixed in many ways, you know, that's where most of the research emanate, and we got some of the best treatment happens right here in the U.S. So yeah, so I'm a strong believer in what I call, you know, American exceptionalism, but also in healthcare. And despite all the critics that we always see, I think that most of the time, uh, yes, there are some problem, and but overall, this is an amazing system, and it can be
Yeah,
improved. It can be improved. It will be improved.
yeah, obviously. Um, it's interesting how people like yourself come from different parts of the world, right? In US, and they start practicing as doctors, and all of a sudden it's like a totally different planet in terms of the way the system works, the relationships with the patients, the whole, I would say, drug industry that's available here compared to other countries in the world. But there is also always this comparison that stays on everywhere and with everybody between the US American healthcare system and the Canadian healthcare system. And you coming from that part of the world, what do you think it's the the drawback of Canadian system compared to
Yeah.
US.
I mean, Canada give me a lot, they give me a wonderful education. And I was from a very humble background, I came from a broken family and, I paid all my study by myself. I'm very grateful for everything Canada has to offer me. But in terms of the healthcare system, um, when it was created, the universal healthcare system in 1967, that's about 1 year after I'm born, it worked well for about 10 years. And after that, then it started to it was bankrupt in a way, and it was highly a lot of fraud and abuse, and because it's free, then people start going to see two or three different doctor, different opinion for, so it gets abused in that way. And then there's waiting lists and waiting time. So uh, when I left there, sometimes you could wait up to 12 months to get a hip surgery done, or, when you're in pain or that type of thing. So, waiting list becomes horrendous. And 1/3 of the population in Quebec, where I came from, didn't have access to primary care system, which is, of course, the open door to everything. You get excellent care in Quebec, but still you need to first start with the primary care. So what do you do when you don't have access to primary care?
Is that
Um,
because there are not enough doctors or there's a long waiting list? What's the drawback on that?
Yeah, I would say that they probably don't produce it for the primary care aspect. They don't produce enough. Yeah. Yeah. And probably many of them leave. That's might be part of the reason too. So, yeah,
Interesting. Um, so now you're practicing primary care in California, right? And you you ended up in a state that's very controversial in terms of healthcare system. Why there?
yeah. Uh, love the state, like California is such a beautiful state, I mean, the last 5 years, we moved a lot. The last 5 years I've been in Arizona. And the return to California is quite recent. Although over the years I've worked a lot here, so I particularly enjoy the northern part of the state and with everything that has got to offer. So yeah, California is kind of controversial. Somehow reminds me of where I come from. So very similar in nature to Quebec, very socialist in a way, and so not something that I'm not unfamiliar with. Um, Again, I go with the opportunity that are being presented. I thought this one was a very nice one. I've been mostly doing leadership, I would say leadership position over the last 10 years. So that's what I'm trying to cultivate or develop, and maybe always try to go to a higher level. Um,
Yeah,
so these type of opportunity kind of drags me a bit different way. So I go with the offer. So but yeah, I love California. I think that there are some issues right now with California that probably will get fixed. The beauty about the US is like the pendulum law. What I call is that when something doesn't work or doesn't work well, it gets corrected. And that's the difference between the US and many other country, which is more like Canada, if you want to compare, where it's more like always the statu quo, So things never change there, but here things change. So, yeah,
yeah.
yeah,
What do you think is the biggest challenge you have right now with practicing primary care in California?
yeah. So right now I practice in a population with a lot of needs. So I would say the most needy, or there's a lot of uninsured in this state. So that's probably the biggest challenge that we have here. It's from a medicine perspective. I mean, it's very gratifying. It's people with a lot of needs where there's a lot of potential to make a great difference for those folks. So I enjoy it kind in this way. Um,
Yeah, it's in a way it's a sad story, right? Because when I asked that question, what's the biggest challenge in primary care, regardless of the state, it seems like the insurance issue comes up the first thing. And the fact that there's so many people uninsured still, that they need so much care, and they don't have anywhere to go, other than either a primary care office or emergency room. It takes a lot of tolls on everyone, right? The doctors, the staff, the hospitals, the offices, like the whole business is pulled down by
yeah.
this thing. What do you
Yeah.
think is a fix?
Uh, I studied the Obamacare in details. I was right in my study, healthcare administration and law at that time. And I think the greatest point in that article of law was the mandate and the fact that they made it mandatory for people to hold an insurance. Now, it's not the number of options that lacks. There's many options. I think there's option for many for all the people. But right, so the mandate in Obamacare was saying that you had no choice. You needed to take uh, insurance, and that was the people responsibility. And if not, you were penalized either through your tax income report or some other sort. And this has been found to be unconstitutional, as you probably heard, by the Supreme Court. So for me, that was the most important and positive aspect of Obamacare. Yeah. And so I think we're kind of in a constitutional problem here with healthcare because yet you cannot oblige people to take insurance, uh, but that's really what would need to be done.
Well, yeah, I tend to agree with that statement, but in the same time, we don't have to forget that the primary cause of bankruptcy in the United States is due to healthcare insurance issues and costs. So I think it has to be some kind of balance at some point. Now, you know, I'm sure you've been through different stages of your life treating different types of patients in different areas. What do you think it's something that comes to mind when it's about an event that kind of marked your life professionally and didn't necessarily go well, but you learn a lot from it?
Yeah, so I think my whole experience to move here in the U.S. was was very hard in a way because either we without really planning for it, but we came here right in the middle of the financial crisis in 2008, and whoever was supposed to put me to work didn't, and so I had to quickly turn around and. I had a lot of resources, and luckily enough, I ended up in a good spot. But back then was yeah, kind of a harsh introduction.
Yeah.
Yeah, so that certainly is something that I haven't forgot. And
Hmm.
certainly went through hardship. At that time, and a lot of incertitude, or not knowing what the future would hold for us. But
Yeah.
yeah,
So what's your present setting right now as a practicing physician?
yeah. So, like I said, maybe for the last 5 or 10 years, I've held mostly medical directorship positions. So. Uh, like I said, I went back to school in 2015. I haven't stopped since then. So did a lot of classes, in healthcare administration, healthcare finance, data analytics, and more recently, machine learning and artificial intelligence. So I try to stay relevant and um, and these are a lot of investment in some way. So I try to put them to use. So whatever I study, I try to apply it somehow. And so, like I said, maybe for the last 5 or 10 years, I hold some medical directorship to some, uh, mostly for, and now, at this stage in my career, I'd like to, probably transmit that over to younger physician. Train, at this stage, what makes me, I was looking at your banner there, and what qualifies success. I would say for me is having gone through all those stages, and being a successful doctor, but at some point it's also to pass it on to the next generation. So I'd like to get involved to some degree with teaching. Would be how I would like to, finish my career and really pass it on to the next generation. Went through some training, specifically for that, like training to teach medicine and so on. I've also recently done quite a lot of a deep dive in research and all those aspects. So I like to touch a little bit of everything. And right now, in terms of the position that it's a that I just recently joined. It's a federally qualified healthcare center. So, like I say, I treat the uninsured or underinsured, and I've been doing that a lot, I would say, over the last 10 years. I find that very gratifying, and the particular organization that I work for needed a doctor to lead their organization. So, in that context, then I joined them, and I think it might well end up being a great match. They want to introduce teach the resident or develop a program for that because we have a teaching university around here. So maybe get involved with this as well. Yeah.
Yeah, that's a great point you made, and I think it's very important for the listeners of my podcast, and in general, I think the medical professionals to understand that to be successful is not about you, and it's not about your career and what you have accomplished for yourself. It's about what you give back to the next generation, to the community, and the impact that you have around you. And I think your example with the underserved population is critical to understand that you can be a very successful physician even if you don't hold, titles and money and salaries and profits and distributions and stocks in big pharma companies, but you hold a big stock in the population and the patients around you. And I think that's a critical thing to be learned. It's very important for me to understand, in people like yourself that had a career like that, if you would look back to yourself, to your own self when you were younger, and you started this medical journey, with what you know right now and what you learned over the years, what kind of advice would you give to yourself?
Yeah. So I was kind of lucky, and often I think about those times, and I was just very young when I decided I wanted to go in that field. Now, I don't know exactly if I understood everything out of it because I was probably in 10th or 12th grade. But I was driven by an empathic need to help the people. And for that reason, I think this is probably what should drag our young, student in medicine, because that's really this way. When you go for those reasons, your chances of being deceived are very small. You're really there for the good reason. You're not there for the status. You're not there for the money and all those other titles like you mentioned. You're really there to basically help the people. So That's the takeout I got from all of this. And I don't know where it came from. It was just something that I was just very young and it was kind of unusual. And at first, probably just the looking at blood what makes me feel sick. Well, of course, you get used to all of that. But yeah, that's a little bit my story. Uh, yeah.
Very nice. Yeah, it's a powerful story, and I think everybody that can relate to your journey, coming from a different country, has seen this as a big opportunity, no matter how you take it, and no matter what you're gonna do with it. It's something that this country offers everyone, right? It's the opportunity of dreaming big and doing what you can and what you want at the level, at the highest level that you can. So anyway, I appreciate your time, and I hope people would kind of listen to this episode and learn a lot from that. What do you want to do next this year? What's next for you? What do you want to
Yeah.
accomplish?
Yeah. So, well, I like to think that, I've always got, a project brewing there and there. I'm kind of an innovator in some way, or always try to find new ways of deliver care or everything. So I've started the new telehealth practice, and that's beside my main occupation, where I aim to treat diabetic people and mostly about, well, lipid or metabolic disorder, I should say, in a televirtual way. I know people are just very busy and it's getting harder and harder to go in, to make it to the doctor, and not to talk about sometimes the waiting time there in the waiting room, waiting to be seen and everything. So I build up a televirtual practice for that purpose. So that's my new episode for this year. We'll see how that goes. There's also, kind of a national shortage of endocrinologists, and as you know, diabetes is really an epidemic.
Yeah.
I think it's probably one of the most prevalent diagnoses that that so I'm really excited with that platform, and I hope it's gonna enjoy a lot of success. Yeah, it's about getting people to target, faster, and making it, easier for people to connect like this with a doctor and seeking
Yeah,
advice.
it's definitely an easier way of people consulting a doctor, I imagine, through telehealth medicine. What kind of business model are you choosing for that? Are you working
Yeah,
with insurances? Is it a cash
yeah,
based?
yeah. So it's basically cash based. I although I we're gonna offer the patient, we're gonna give them a receipt, and they might turn around and try to get this reimbursed. Maybe the insurance will take a good part of it to, but it's basically a cash based service. Yeah. And it's a kind of a you know uh, uh, a nice service, I think. So offering those type of service after hours and on weekends
Yeah,
and everything, that
yeah,
counts for a premium, I think. I think that, I still try to make it like very affordable so that people can achieve their goal, and it's still very decent
yeah.
price. Like I said,
How do you think of developing the system? Is it a matter of marketing? Is it a matter of building your business skills? What do you think is the best way to grow this?
yeah, that's a really good question. I've done telemedicine maybe or had some experience of it maybe for the last 5 or 10 years. So I saw what other models are doing. So in this case, I built my own, EMR practice, and it's a fully integrated one with a virtual website included in it and everything. And like you said, probably the challenge is mostly with the marketing aspect, is how you gonna reach the population that you are. Is it even going to be popular? I'm not
Yeah.
sure. Sometimes people, unfortunately, like medicine or health is never like often a priority of people. Maybe it shouldn't be that way, but that's the reality is that people will,
Yes, but in the same time, I think it's the fact that it's so easy for people to get on an appointment like that with someone like you know, very available, I would say, and very affordable on a phone, right? Everybody has a phone these days. You don't have to look for people that don't have a phone anymore. So I would imagine it's easy to get out, you know, with the word that this type of practice is very accessible to people. The question is, are those that are underserved, like you said, in your demographic area, are going to afford this type of cash payments for your service?
yeah, so these are, I'm very targeting two different clientele here. And if not, it would kind of put me in a conflict of interest, I would guess, with my, so they're very different service, I would
Hmm.
say. Yeah.
I see.
Um, but yeah, I think it's a great product. I think you will see televirtual service expand like this a lot in the future. There's
Hmm.
a lot that can be done virtually, and even like we talk about the rural aspect. Sometimes to reach out to people who otherwise don't have very much access to medical care in remote
Yeah.
areas of the country and so on. So there's a lot of opportunity for that. Yeah.
Yeah, absolutely. I
And
was just talking to a different guest a couple of days ago about the rural medicine access in the United States in the remote areas, and that's one of the biggest issues that we face right now is that the fact that they live miles away from any kind of like urgent care center or anything appropriate for a medical visit. So those telehealth practices and virtual medicine is gonna catch up really fast on those areas.
so
So yeah, let's do a little marketing then for you. How can people reach out to you, know more about your
Yeah,
practice?
well, they can go on my app. Thank you so much, Dr. Franco, and thank you, by the way, for the invite, which I'm so grateful.
Absolutely.
Uh, yeah, so I got my app is Dr. Martin Dufour, so first name and last name dot app, and that's my virtual website if you want. And then there's all the information on how to how we proceed and how to schedule if people are interested. Right now, I'm kind of limited to 5 states where I hold an active license. So
Hmm.
that's mostly for people of, Florida, Ohio, North Carolina, Arizona, and California. But hope to expand to many other states. If this takes off, then we're gonna try to get license in more states and try to reach out to even more people. And
Yeah,
so thank you
that's
for
a great idea.
yeah.
I wish you good luck, and I'm sure you're gonna be successful in this too. Um, you bring something different and new to this environment, so I hope it's gonna work well for you.
You're so kind. And thank you again for the platform and the opportunity to tell my story to the folks. I hope this is inspiring in some way.
It
And
will be. Thank you
yeah,
so much for coming.
yeah. Thank you.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.